You know, nothing is more satisfying than after we have accomplished feeding our baby. It feels so good. We've given them something good and they've taken it until all of a sudden, like out of a scene from Exorcist, projectile right out of the mouth. Just about everything you've given them, so it seems. That's called spit up, and it makes us really freaked out when we see this. So I'm just gonna tell you what's normal and what's not so normal when you go to your pediatrician to discuss this with them. First, the most common causes of spitting up: normal gas, overfeeding, and reflux. Normal gas is just basically too much air getting caught up in your baby's mouth and trapped in their little stomachs while they're sucking on a bottle or the breast. This is really normal, but unfortunately it can produce some forceful spit up, which can kind of scare us, that spewing I was talking about. And it seems like there's a whole lot when this happens, but in truth, it's just a couple of teaspoons, maybe a tablespoon or two. And it doesn't mean that you need to refeed your baby. And that brings me to overfeeding, which can produce the same results. Most babies can only take up to 2 to 3 ounces at a time every 2 to 3 hours for the first 3 to 4 months of life. That's a mouthful. But in that case, we want to make sure that we're just reducing the amount of ounces a little bit if it seems that your baby is projectile spitting up because they're eating too much at a time. If you're breastfeeding, you can't really detect how many ounces they're getting, but the good news is that it's almost impossible to overfeed them if they're feeding at the breast. And finally, reflux. This one is most difficult for parents. It's caused by poor muscle tone in the digestive system, which makes it difficult for food to stay down, which means it's escaping through the esophagus and out their little mouths and even their nose. This occurs mostly when baby has been laying down on their back. It happens typically 15 to 30 minutes after a feeding. And it's difficult for them because there's no help from gravity holding things down. The good news is that most reflux isn't painful, and you can help them out a bit by just holding them upright for about 15 to 20 minutes after each feeding at about a 45-degree angle. Now, when you do have to lay your baby down in the crib, make sure you have a little wedge, you can purchase them at baby stores, that fits underneath the crib mattress, not on top of the crib mattress. Remember, to keep baby safe in their crib, we can have nothing in that crib. No loose blankets, no wedges, and no positioners. You need to call your pediatrician if you notice that baby is persistently projectile vomiting after every feed. Also, if your baby is arching their back and writhing in pain 15 minutes after every feed, give them a call then as well. Also, if they're having trouble gaining weight, that's a really poor sign. And finally, if you see streaks of blood in their spit up, fever, distended stomach, unusual behavior, those sorts of things you really want to look out for, call your pediatrician if you see any of this. So that's Spit Up 101. And at about 6 months, when the muscle tone in their digestive system gets a little stronger and they're eating solid foods, this really starts to go away, and that's really good news. All right, thank you for joining me. I'm Jenni June. Enjoy your baby.